Hello, Mr. Devon Jones. My name is Malikat, and I would like to explain what high blood pressure, also known as hypertension, means and why it is important to manage it early. So, blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood throughout your body. Normally, the blood vessels are usually flexible and they can adjust to changes in blood flow. But with hypertension or high blood pressure, the pressure inside the vessel stays too high over time, causing damage to the blood vessels, heart, your kidneys, brain, and other organs. Primary hypertension is the most common type, and it develops gradually over time due to combination of genetics, lifestyle habits, stress, diet, weight gain, alcohol use, lack of physical activity, and smoking history. In your case, your strong family history of hypertension, alcohol intake, weight gain, and stress from working in a high crime environment, also your limited exercise and poor diet, they all increase your risk. So, when it comes to secondary hypertension, it is high blood pressure caused by another medical condition, such as when you have like kidney disease, or you have or you're on certain medication, or you have endocrine disorders. So, complementing hypertension occurs when uncontrolled high blood pressure damages organs such as your kidneys, your eyes, brain, and your heart. It can lead to serious complications like heart failure, stroke, or chronic kidney disease. One of the most important concerns in your history is that both of your parents, they died from hypertension, and your mother also had type 2 diabetes. This suggests a strong genetic and cardiovascular risk profile. Also, I would like to address your shortness of breath with activity and your recent weight gain. They may indicate that your heart is already working harder, working overtime to pump blood against increased pressure, which over time, when you sustain hypertension, it causes heart muscle, especially the left ventricle, to thicken in response to the increased workload. And eventually, the heart becomes stiff and less effective at pumping blood, which may lead to heart failure. Hypertension also affects the lymphatic and vascular systems. The lymphatic system helps regulate fluid balance and inflammation within the cardiovascular system. And dysfunction in this system may worsen cardiovascular disease progression. There have been recent research that shows that the lymphatic vessel changes and inflammation contribute to cardiovascular